Have you ever had a blood test and your doctor said, your A1C is a little high, and you had no idea what that meant? You're not alone. In this video, I'll explain what A1C is, what the numbers mean, and why it's one of the most important tests for diabetes, all in just a few minutes. Hi everyone, welcome back to the channel. If you're interested in understanding diabetes and staying healthy, make sure to subscribe because I break down medical topics in simple, easy to understand videos. Now let's talk about A1C. What is A1C? Imagine your red blood cells are tiny delivery trucks traveling around your body. Their job is to carry oxygen. But whenever sugar is in your bloodstream, some of that sugar naturally sticks to these red blood cells, kind of like syrup sticking to the spoon. The more sugar that's been in your blood over time, the more sugar sticks to these cells. The A1C test measures how much sugar has attached to your red blood cells. Since red blood cells live for about 3 months, your A1C gives doctors an average of your blood sugar over the past 2 to 3 months. That's why it's different from checking your blood sugar with a finger prick, which only tells you what's happening right now. Why is A1C important? Think of it this way. Checking your blood sugar with a glucose meter is like checking today's weather. A1C is like looking at the climate over the last 3 months. Doctors use A1C because it shows the bigger picture. It helps diagnose diabetes, monitor how well treatment is working, and estimate your risk for long-term complications. So what counts as a normal A1C? Here's a simple breakdown. Below 5.7% is considered normal, 5.7% to 6.4% means prediabetes, and 6.5% or higher on 2 separate tests usually means diabetes. If you already have diabetes, many adults aim for an A1C of less than 7%. Although your personal goal may be different depending on your age, overall health, and your doctor's recommendations. When blood sugar stays high for a long time, it can damage blood vessels and nerves throughout the body. Over the years, this can increase the risk of heart disease, kidney disease, vision problems, nerve damage, foot complications. The good news is that even lowering your A1C by a little bit can significantly decrease the chances of these things happening. Can you lower your A1C? Absolutely. For many people, A1C improves with healthy lifestyle changes and, when needed, medication. Some of the most effective ways include eating a balanced diet with few added sugars and refined carbs, exercising regularly, taking medications exactly as prescribed, monitoring your blood sugar if your healthcare provider recommends it, and getting enough sleep and managing stress. Small, consistent habits often make the biggest difference over time. A common misconception is that if your blood sugar is normal today, your diabetes is under control. Not necessarily. Your blood sugar changes throughout the day depending on meals, activity, stress, and many other factors. That's why A1C is so valuable. It reflects your average blood sugar over the past few months instead of just one moment. So here's the takeaway. A1C measures your average blood sugar over the past 2 to 3 months. Below 5.7% is normal, 5.7% to 6.4% indicates prediabetes, 6.5% or higher may indicate diabetes, and keeping your A1C in your target range can help reduce the risk of serious complications. If you found the video helpful, give it a like, subscribe for more easy to understand diabetes education, and let me know in the comments what you'd like me to explain next. Thank you for watching. I'll see you in the next video.